Vitalica, light the way.
Have you ever gotten your blood test results back and felt like you were trying to read, I don't know, a secret code? Well, today we're going to crack that code. We're diving into one of the most common medical tests out there, the complete blood count, or CBC. Think of it as a report card for your body, and we're about to learn exactly how to read it. You know that feeling, right? Something just feels a little off. Maybe you're tired all the time, or you get a fever out of nowhere. What if I told you that these aren't just random things? They're actually clues, and deep inside your own blood, there's a story waiting to be told. So, what is a CBC? It's basically an internal investigation report for your body. It's a super common, really simple blood test that gives doctors a snapshot of what's going on inside you. It helps them spot the very first signs of all kinds of things, from infections to anemia. So, when does this whole investigation kick off? Let's take a look at why your doctor might say, yep, we need to run a CBC. It all starts when your body sends out some signals that a case needs to be open. These are the classic clues right here. Things like feeling completely wiped out all the time, a fever that just won't quit, or bruising easily. These are the red flags that make your doctor think, okay, let's gather some evidence. A CBC is pretty much the perfect first step. Now, to understand the results, you've got to meet the key players, the cast of characters, if you will, that the test is actually looking at. We're talking about the three main types of cells that are cruising around in your bloodstream, each with a super important job to do. All right, first on our list, we've got the delivery guys. These guys are on the move 24/7, making sure your entire body has the fuel it needs to run. These are your red blood cells. Inside them is this amazing protein called hemoglobin. Its whole job is to grab oxygen when you breathe in and then zip it around to every single part of your body. Think of them as the ultimate oxygen delivery service. Without them, we'd be in big trouble. Okay, next up, let's talk about the protectors, the bodyguards of your internal world. Your white blood cells. These are the soldiers of your immune system. They're your first line of defense, hunting down and fighting off nasty invaders like bacteria and viruses. They are absolutely essential for keeping you from getting sick all the time. And last but definitely not least, we have the emergency first responders and the repair crew all rolled into one. These are your platelets. They're these tiny little fragments that spring into action anytime you get a cut or an injury. They rush to the scene and clump together to form a clot. This is what stops the bleeding and kicks off the whole healing process. Pretty incredible, right? Okay, so we've met our players, but the CBC isn't just a roll call to see if they're there. It's a head count. The number of each of these cells is the real evidence. That's what tells the story. This is where the detective work really kicks into gear. So for hemoglobin, if that number is low, it's a huge clue for anemia, which could totally explain why you're feeling so tired. For white blood cells, a high number often screams infection. Your body is sending in the troops. A low number might mean your immune system is a bit weak. And with platelets, it's a balancing act. Too low, and you might have a bleeding risk. Too high, and you could be at risk for dangerous clots. And get this, the CBC can get even more detailed. There's something called a WBC differential that tells you which type of white blood cell is elevated. For example, a spike in neutrophils usually points to a bacterial infection, while more lymphocytes might suggest a virus. It's like knowing if the police or the fire department responded to the call. Okay, so the lab gives us the numbers, the evidence is in, but what does it all mean? Well, the next step is connecting those dots to actually crack the case. The number of things a CBC can help uncover is just amazing. It can point to anemia, different kinds of infections, bleeding issues, and even flag serious conditions like leukemia. It's also a go-to tool for doctors to see if treatments, like chemo, are working the way they should be. So this is how it all comes together. Your doctor doesn't just look at one number. First, they start with your story, how you're feeling. Then they look at the hard evidence from the CBC report. They're looking for patterns, like connecting that fatigue you mentioned with a low red blood cell count. And from there, they figure out the next steps. So, what does this all mean for you? Well, let's talk about the most important part of this whole story, your role in your own health investigation. And this is probably the single most important takeaway. A CBC is an amazing screening tool. It gives us the clues, but it is not the final verdict. An unusual result isn't a diagnosis, it's the start of a conversation with your doctor. This quote really just says it all. The numbers on the page are just data. The real magic happens when a doctor can look at those numbers in the context of you, your health, and your story. So be part of that conversation. Ask them what the numbers mean for you. Ultimately, the CBC is all about empowerment. It turns those vague feelings into real, concrete information that you and your doctor can work with. It allows you to be an active player in your own health journey. Your blood is telling a story. The only question left is, what will you learn from yours?